and you're very welcome to the HRB Where Are They Now series, where we are celebrating and reflecting on 40 years of the Health Research Board. I'm your host, Dr. Claire O'Connell, and yes, can you believe it? The HRB is 40 years on the go, and in those 4 decades, the HRB has supported an enormous amount of research and a great number of researchers to support and shape health and social care in Ireland and beyond. And to mark the occasion, as the name of the series suggests, we are speaking with people who at some point in their career have received support from the HRB, or they reflect the HRB's priorities. And in this episode, we are joined by Professor Peter Doran. Hello, Peter.
Hi, Claire. How are you?
Great, thank you. Great. So, Peter, you are the director of the Clinical Research Centre at University College Dublin, so the UCD CRC, and you have your own big birthday this year. I believe you've been on the go for 20 years, 20 years of growing. So, congratulations on that.
Right.
You also have the glorious title of Professor of Clinical Trials at the UCD School of Medicine. And before we talk about the HRB, tell us a little bit more about clinical trials. How important are they? And how has the landscape changed in Ireland over the years when it comes to clinical research and clinical trials?
So clinical trials, Claire, are critical to ensuring that the interventions we apply to patients have been tested to make sure that they have the best possible impact and are also safe for deployment. So clinical trials are the way in which we generate evidence of sufficient quality to use in clinical practice. Without clinical trials, we would be in a time of trial and error, testing things without any proper scientific rationale. A clinical trial, though, allows us to test an intervention in a carefully controlled, protocolized manner to ensure that it's appropriate for diffusion into the healthcare system. So without clinical trials, we'd have an even more chaotic healthcare system than we currently have. Clinical trials give us a really clear pathway to progress. So trials are an important part of discovery, but they're also an important part of the health system itself. Indeed, there's clear international evidence to show that health systems that embrace clinical research, that have high levels of engagement in clinical trials, deliver better outcomes for patients. And I guess in that way, what the HRB has done in really transforming the clinical trials ecosystem in Ireland has been of such impact, not just to the academic community, but to the wider health system. By building that ecosystem, the HRB is actively changing outcomes for patients.
And what does it mean to have a lot of clinical trials running in Ireland? What does that mean? How do patients benefit from that?
Well, first of all, Claire, the environment in which clinical trials happen is an environment that's characterized by the availability of the latest technologies. It's characterized by having people with curious minds where inquiry becomes the order of the day. So firstly, a highly active clinical trials environment is a place where we as a collective want to do better. Environments where we want to do better means that we're best positioned to take on board all of the new developments that happen in medicine and apply those to patients. Clinical trials, though, they also put a significant focus on the patient because we're now thinking about things that the patient needs. So clinical trials by design are implemented in areas of greatest participant need. So a critical part of clinical trials is understanding what the gaps are for patients, not just for the health system, not just for the staff in the health system, but for patients. So a highly active clinical trial environment is also de facto a very, very focused environment on ensuring that patients' needs are firstly identified and secondly responded to.
Great. And as you say, it means patients get access to, I suppose, the latest advances in technology and medicine in a very structured way as well.
Yeah.
Um, and I suppose in terms of, I know you're on the board of the HRB, but are there specific ways in which the HRB has enabled that environment in Ireland over the last 40 years?
Yeah, I think I think it's fair to say that when it comes to the clinical trials environment, the HRB has done just about all of the heavy lifting. through its long-standing program of supporting clinical research facilities and centres, through its support of clinical trial networks of Cancer Trials Ireland and its predecessor ICORC, but also through very important initiatives like the Trials Methodology Research Network and the PPI Ignite Network. The HRB really has created the infrastructure in which centres like the one I direct are able to expand and deliver a very comprehensive trial program that's benefiting our patients. So without the HRB's investment over the last number of years, I can't see how we would have got to a point where clinical trials in many centres have become a core part of what we do. I think that work has also then been foundational in creating an environment where not only are Irish centres participating in clinical trials, but Irish investigators are leading clinical trials. So, for example, we have a number of Irish investigators supported by the Health Research Board through the investigator led clinical trial funding programme that are leading internationally recognized clinical trials. So the HRB's investment, the HRB's support, and the HRB's enablement of clinical trials is not just affecting patients in Dublin, Cork, Galway, and other Irish places, but actually impacting international science as well.
Brilliant. And how did you get into this whole field, Peter? When you were growing up, like, were there any early signs that you were going to move in this direction?
Um, no, I must say, kind of reflecting my initial love and probably one of my things I'm still most interested in is maths. I hadn't pictured myself as a biologist at all. When I was in my teens, both my parents died from cancers. And one of the things I guess that set about in me was a curiosity, a kind of a desire to understand a little bit more. And it drove me away from, I guess, a more maths focus where I thought I would have been into one of trying to understand biological mechanisms. I think then post my PhD, which I completed in UCD, and I should note was funded by the Health Research Board all the way back in 1999. After that time, then I began to really challenge myself to think about how I could play a role in ensuring that scientific advances were translated into impacts for patients. And in fact, this is one of the areas that I suppose in many ways has directed all of my career since then, Claire, and the HRB has been a consistent part of that all along. In that, if we think, my mum died in 1989. And at that time, the 5 year survival for her cancer was less than 20% because of all of the research that was done in the meantime and all of the clinical trials that were done in the meantime. The 5 year survival for her type of cancer, were she to have it today, is over 90%.
Wow.
To me, that's always been kind of a guiding light in terms of why it's important that agencies like the HRB work closely with the research community to make sure we continually make progress, to make sure that that incremental, stepwise, steady progress continues to be made. Because on the other hand, my dad, if he was diagnosed today with his condition, his survival chances today are not much better than they were in 1991. So there's still more research to do.
And that's a huge personal driver for you, I'm sure. Of some things that happened in your family. It's such a formative time in your life as well. I'm interested that the HRB funded your PhD. We have that in common. They funded a year of mine actually in the 1990s as
Yeah.
well, and I was very glad of it as well.
Same
Um,
here.
and I suppose if you could go back in time to when you
Mm,
were doing that PhD, to when you were developing that interest in
mm,
biology and how to apply things clinically, what
mm.
would you say to yourself at that point? What advice would you give
Yeah,
yourself?
I think probably one of the things I would do, and kind of reflecting on my career, which, as I say, in many ways aligns with the celebration of the 40th of the HRB. I think one of the things I would say to myself, if I could go back, is be more tuned into the patient voice. The bit that today, given the support of the HRB for things like PPI Ignite, is a typical kind of guiding principle of everything we do, that patient voice, that recognition of what's important to patients. If I could give myself any advice, I would go back, those 30 years and say, that's the bit you need to really, really think about. That's the bit you really need to focus on. Because I still spend a lot of time thinking about, how do we engage patients earlier? Not in a trivial manner, but in a way that helps us to better define the research questions that we need to apply science to. So I think that's probably the first thing I would say to myself. And the other thing I would say to myself if I could go back is that despite through all of our careers in research and in academic life, there will be ups and downs. There's time of great success. There's times of great challenges. The one thing I would do if I could go back is I would kind of really point to myself that entities like the HRB will be there. They will continue. They occupy a really important place in Irish public life because of the work that they do, and they'll be a mainstay. Many things will change, many things will evolve, but entities like the HRB, because of that really clear commitment they have to improving healthcare in Ireland, they will be there. They'll guide us, they'll support us, and they will help to ensure that the work that we do can be realised for patient benefit.
Great. Well, thank you for sharing your insights and your story with us today, Peter. And definitely maths' loss was biology's gain, I think, in this instance.
Well,
Although I have to say, in the last kind of, in the intervening years, maths and biology have become much more enmeshed, and data science and everything. So you've two
yeah.
superpowers.
Absolutely. My thinking of my first grant being my PhD. My last award was more recently, just before Christmas, and it's AI in healthcare, a big focus on machine learning in clinical trials. So you're absolutely right. Maybe I'm getting to the point where I can recover some of my maths interests as well.
Exactly, exactly. Well, thanks, Peter, Professor Peter Doran, for joining us on the HRB Where Are They Now series. And if you'd like to find other episodes in the series, check out the HRD. The HRB YouTube channel. But for now, for me, Dr. Claire O'Connell, Slán, and thanks for joining us.